Hello, my name is Rob Karobkin. I'm here today to ask the Senate Committee on Health, Education, Labor, and Pension to vote in support of the Opioid Treatment Access Act, which will amend the Controlled Substances Act of 1971 and other federal regulations to dramatically expand patient access to the opioid agonist methadone. I'm the owner-operator of a 20-bed residential program in Gorham, Maine for men who've struggled with drugs in the past and are now coming out of Maine's jails and prisons. I'm also a graduate student at the Boston University School of Public Health, as well as a person in long-term recovery from substance use disorder and mental illness. So I'm here today to offer a personal, professional, and academic perspective as to why we must expand access to methadone right now. To begin with, methadone works. In a recent Canadian study published in 2018, researchers in British Columbia compared the health outcomes of over 14,000 criminally convicted opioid users over the course of 17 years. There have been many studies demonstrating methadone's effectiveness outside of this, but this study was conducted over the longest duration of any of them to date, and the results are staggering. Among participants prescribed methadone, after 17 years, well over 90% were still alive. Of those not receiving the medication, fewer than 75% had survived by the end of the 17-year period. The Opioid Treatment Access Act is a bipartisan effort sponsored in the Senate by Senator Rand Paul and Senator Ed Markey that would allow methadone patients to overcome the current draconian constraints that they face accessing this amazing life-saving medication. If passed, the bill would change prescribing guidelines and practices, enabling methadone patients to acquire a 1-month take-home supply, not just receive 1 dose per day of the medication. They could consult with their prescribers via telemedicine and could receive their doses at a pharmacy or from a mobile clinic, not just in person at a brick-and-mortar opioid treatment program. And methadone patients could do so more readily, without needing to wait months to have any take-home privileges at all. I regularly hear young people here in rural America tell me that it feels like they're living through an apocalypse. 20-year-olds tell me that they've come to dread logging into Facebook because they fear seeing yet another announcement that a friend they graduated high school with just a few years ago is now dead of a fatal drug overdose. And with over 100,000 fatal overdoses across our country last year, it's hard to argue with the idea that it's time to help our communities climb out of the hell that illicit opioids have currently plunged so many of them into. If we want health in our communities, we need to stop trying in vain to cut people who use dangerous drugs off of opioids altogether, which doesn't work, and instead offer them a safe medical supply of the non-debilitating opioid, methadone. And if we want freedom in our communities, we need to make sure that the system through which we provide this wonder drug offers the people on it the opportunity to live free lives, even if doing so might seem risky at first, freeing them from the unnecessary burdens imposed on them by the current methadone system. And if we want unity in our communities, we need to stop fighting with each other over drug policies that have never worked and instead embrace bipartisan solutions like the Opioid Treatment Access Act that are bringing leaders together across the political spectrum. Thank you.